So we're going to change the format of the slides a little bit. Had some technical difficulties with my screen recorders, so I switched screen recorders, but now I record my whole screen rather than just the slides. So bear with the change. Let's look and move on and going back. Okay, so going back, we've looked at arteries and we've looked at veins and the difference in their structures. The main difference, there's two of them, being arteries have a larger tunica media than veins do. Veins don't need it because they've got the valves inside that help prevent backflow of blood. Moving on to capillaries. Capillaries are only one cell layer thick. They don't have the tunica externa. They don't have the tunica media. They only have that tunica intima layer, which means it's one cell layer thick, which is what allows or where the exchange of nutrients and blood happens between the blood vessels and the tissues. So there's two types of blood vessels in capillary beds, okay? You've got a net of structures. This is your capillary bed. You've got your terminal arteriole, which is the last part of the arteriole right before it goes into the capillary bed. Off of that arteriole, you have vascular shunt that branches off, and the vascular shunt travels all the way through and back into the vena cava. You've got these precapillary sphincters because that controls how much blood or what's happening in the capillaries at the time. Let's take, for instance, that big bad bear is chasing you and you're trying to run away. What's going to happen is your system is going to shut down these precapillary sphincters, not to your muscles. You want the blood vessels open wide going to your muscles, but to your mesentery, to your digestive system, and your extremities. When you get stressed, your hands tend to be cold. These sphincters contract and prevent blood flow going into the capillary bed, and so that it just passes through the shunt back to the vein and back up to the heart. The reason being is it's diverting all of the blood it can to your muscles and to your brain to get out of danger. So the entrances are guarded by these precapillary sphincters. They contract or they open depending on what happens. Say you're really hot, maybe you have a fever, those capillary sphincters will open up to allow for the blood to go out to the extremities or into the capillary beds of your fingers and your skin to allow it to cool off. Moving on, let's talk about homeostatic imbalance in regard to the capillary beds. There is a condition called varicose veins, and you see them. So usually in heavier set people who stand for long periods of time, you'll see veins, like light blue veins or spider veins almost, popping out on their legs. Those are due to incompetent valves in the veins as it heads back up to the body. Okay, it's a predisposition for thrombophlebitis. Thrombophlebitis, basically, if you look at the name, itis means an inflammation. It's an inflammation surrounding the blood vessel that is blocked off or that is incompetent, that the valve is not working. So you have the varicose veins, which is the thrombophlebitis is on the external side, so it's on your skin side. The other version of this is deep vein thrombosis, which is where you have this blood clot that forms where the valve is because the blood's not moving the way it should. That's your deep vein thrombosis. It's the same thing, only it changes where it's located. So thrombophlebitis is going to be towards the outside or the surface of your body. deep vein is going to be deeper. Let's take a look at systemic circulation. We've already looked at the blood leaves the heart through the ventricles, goes into the arteries, down to arterioles, down to capillary, and back again, up through the venules, the veins, in through the atrium. But let's get a little bit more specific, first looking at the first blood vessel to leave the heart, the big one, which is your aorta. Okay, it leaves from the left ventricle, and off the top of it, you've got three, see it right here, three blood vessels that leave. You've got the first one, which is your brachiocephalic trunk. Okay, your second one is your left common carotid, and your third one is your left subclavian. The only difference between the left common carotid and left subclavian and the brachiocephalic trunk is that the body on the right side leaves the brachiocephalic trunk, which then later breaks into the right subclavian artery and the right common carotid. If we look here, you've got the brachiocephalic trunk that goes up, and then the split happens just as it passes behind the clavicle. So it goes into the common carotid and then the subclavian. Okay, so let's look at the subclavian. We're going to look at upper body arteries first, and this is an overview. I'm highlighting the blood vessels I want you to know. So I want you to know that the subclavian artery then turns into the axillary artery, which turns into the brachial artery. The brachial artery then splits into the radio and the ulnar artery. Those are the blood vessels I want you to know for the upper limb. It's the same on both sides. Okay? You've got your right and left coronary arteries that serve the heart. So here is your left coronary artery that travels along the left ventricle, and your right coronary artery that travels along the right ventricle just underneath the right atrium. You've got your aorta. There's four parts to the aorta. There is four parts to the aorta. You've got the ascending aorta, which comes off of the heart. You have your aortic arch, which is the arch where these three blood vessels come off of. You've got your descending aorta that's divided into two areas, your thoracic aorta and your abdominal aorta. Obviously, the thoracic is in the chest area. It travels behind the heart and lungs. And then once it passes through the diaphragm, it then becomes the abdominal aorta. Okay, we've covered subclavian arteries. Your intercostal arteries, not going to worry about them so much. Your aorta, as it passes through the thoracic area, supplies blood to the lungs, the esophagus, and the diaphragm. And then as it passes through the diaphragm, okay, it becomes the abdominal aorta, which gives, hold on, I'm looking for the slide, here we go, which gives blood supply to all of the organs within your abdomen. Your celiac trunk is the first branch of your abdominal aorta as it comes through the diaphragm. There's three branches, the left gastric, splenic, and common hepatic. We've got your mesentery, which is the slippery connective tissue that surrounds your intestines. But let's look here. So you've got your celiac trunk, which is very top here, but more so you've got your hepatic artery, which supplies your liver, and then you've got your renal arteries here, which go to the kidneys. Goes down further. You've got just below the renal, you've got your gonadal artery, which supplies either your ovaries or your testes, depending on whether you're male or female. And then you've got your mesenteric artery, which supplies that connective tissue and the small intestine and half of the large intestine. The aorta splits into the common iliac arteries, and this split happens on both sides. We're going to follow his left side down. So you've got your common iliac artery, which is internal. Once it passes through the ilium of the pelvis, it becomes the external iliac artery. It then splits and travels down. There's a branch off here. After that branch, it becomes the femoral artery, and then switches to the popliteal artery. The popliteal artery you find behind your kneecap, okay, and then the popliteal artery travels behind and then eventually splits into your anterior tibial artery and your posterior tibial artery. Your anterior tibial artery travels down and then becomes the dorsalis pedis artery. Those are the main arteries that I would like you to know. Let's talk about venous return. You've got your vena cava, superior vena cava, and your inferior vena cava that enters into the right atrium. Okay, let's follow the body back. You've got your dorsal venous arch that then travels up into the saphenous vein. Now there's a slight variation on the venous return. The saphenous vein is the longest blood vessel in the body. It goes from the ankle all the way up to the thigh and enters back into that external iliac vein. On the outside, you have your anterior tibial vein, which then connects in with the popliteal vein. The popliteal vein then goes into the femoral vein, meets up with the saphenous vein at the external iliac, and then once again it passes through the ilium of the pelvis and becomes the internal iliac vein, meeting with the other side, becoming the inferior vena cava. You have your renal veins returning from the kidneys. You have your hepatic portal vein returning from the liver, passes up through the diaphragm, and then meets up with the superior vena cava to enter into the right atrium. Looking at the upper limb, you've got your radial and your ulnar veins that meet up with your brachial and then the axillary subclavian into the superior vena cava back into the right atrium. Okay, looking at the brain though. So we haven't really talked about blood supply to the brain. You've got the common carotid. Okay, so here's your aortic arch. You've got your left common carotid artery, and then you've got your right common carotid artery that comes off of the brachiocephalic. Okay, that goes up and splits into your internal carotid and your external carotid. Your external carotid artery supplies the outside, your scalp, your face, and so on. The internal carotid artery supplies your brain with blood and nutrients to work. So the internal carotid arteries divide into anterior and middle cerebral arteries. They supply mostly the cerebrum. And then your vertebral arteries, once inside of the skull, form the basilar artery, which serves the brainstem and the cerebellum. Let's look at this picture here. So here is your internal carotids right here. Okay. You have got your middle cerebral artery, which serves your cerebrum. And here would be your other cerebral artery. You've got your anterior cerebral artery here, and that's the front part of the circle of Willis. This whole section here is called the circle of Willis. Here you've got your posterior communicating artery, which goes into your basilar artery. Basilar artery then becomes the vertebral artery. The basilar supplies the cerebellum and the brainstem with blood. You've got your posterior cerebral artery. Mostly I want you to focus on the circle of Willis here, okay? Basilar artery, your internal carotid artery turning into your middle cerebral artery. Here is your posterior cerebral arteries supplying the cerebrum, basilar artery supplying the cerebellum and the brainstem. Okay, let's look at fetal circulation because there's something a little different with fetal circulation. Fetal circulation is a temporary circulation. It's not something that is a permanent fixture. And it happens through the umbilical cord. When a woman is carrying a baby, the fetus has the exchange of gases or receives the gases and nutrients it's going to need through its placenta. The umbilical cord contains 3 vessels. You've got your umbilical vein and you've got 2 umbilical arteries. Okay, your umbilical vein, now remember, veins travel away from the heart. The umbilical vein carries the blood-rich or the nutrient and oxygen-rich blood to the fetus. There's 2 umbilical arteries that carry carbon dioxide and waste-laden blood away from the baby into the placenta. Okay, so you've got your color code here. Here is your umbilical vein. Okay, here are your 2, right here, your 2 umbilical arteries. Here is your placenta. Right, what these blood vessels do is they bypass the normal blood vessels of the fetus. So up here, you have your umbilical vein, and you've got your hepatic portal vein, which is bypassed, and your umbilical vein comes right into the inferior vena cava to then go up into the heart. One of the other things that you're going to see is you don't see the blood going into the lungs so much. There is a foramen ovale which allows for that bypass because the blood doesn't need to go to the lungs in order to get oxygenated. It comes in through that umbilical vein. And then on the way back with the aorta actually through the internal iliac artery is diverted into the umbilical arteries to go back into the placenta. Once the umbilical cord is cut, this then shuts down, and all of these then recirculate. There are shunts that close down and allow the lungs and the liver of the baby to start working. Moving on, let's look at pulse points. You've got your major pulse points here. If you feel in your temples, very gently, you'll feel a gentle pulse in there. That's your superficial temporal artery. You've got your facial artery. If you feel the corner of your jaw, it will be just under there. Not so easy to feel, a little bit more on the difficult side to find. You've got your common carotid artery. That is your easiest artery or easiest pulse point to find. Your brachial artery here, okay, that is the artery that's used in finding blood pressure. Radial artery at your wrist. Femoral artery is going to happen in your groin, relatively easy to find. Popliteal artery behind your knee. Posterior tibial just behind the medial malleolus of your ankle, and then your dorsalis pedis. Names should sound familiar. Now that we have found our pulse points, let's talk about how to take blood pressure. I've already said that we find most commonly blood pressure through the brachial artery. The blood pressure that we take with a blood pressure cuff measures the amount of pressure that the blood exerts against the inner wall or against the blood vessels behind that cuff. It's the force that continues or allows the blood to continue the flow in the blood vessel. Okay, so if you look at blood pressure, you put the cuff on until you stop blood flowing through the artery. Okay? Your systolic pressure, which means when your ventricle is actively pumping, it's going to have the most force against the blood pressure cuff to allow blood pressure to move through. That's your systolic pressure. That's your high number on the blood pressure. You'll feel the pulse as they're taking your blood pressure, but as well, when you have the stethoscope on the brachial pulse, you will hear it as it begins to move through. So you inflate the blood pressure cuff until you stop blood flow. You put your stethoscope over the brachial pulse to listen for when the sound of the blood starts to flow back into that artery. You'll feel it. The first time you see it is your high number, your systolic pressure. And then you will hear it until all resistance is gone from the blood pressure cuff. That is your diastolic pressure. That's where your 120/80 number comes from. 120 is your systolic, 80 is your diastolic, and it is the difference of where you hear the resistance from the blood as it works its way through the blood pressure cuff.